CDC in crisis. Former officials warn agency may not survive under RFK Jr. The U.S. Centers for Disease Control and Prevention, CDC, is facing an unprecedented crisis under the current administration, with former leaders warning the agency's credibility and even its survival is at risk. 3 high-ranking ex-officials have described a chaotic and scientifically dismissive environment that has emerged since President Trump's second inauguration and the appointment of Robert F. Kennedy Jr. as Health and Human Services HHS Secretary. Disregard for expertise and science. Dr. Daniel Jernigan, former director of the CDC's National Center for Emerging and Zoonotic Infectious Diseases, described the situation as in-your-face disregard for scientific expertise. This sentiment was echoed by Dr. Deborah Oury, former chief medical officer, and Dr. Demeter Daskalakis, former director of the CDC's National Center for Immunization and Respiratory Diseases. All 3 resigned after the controversial firing of CDC Director Susan Monarez in August, who was dismissed for refusing to approve what her legal team called unscientific, reckless directives. The core issue is a reversal of established public health principles. Instead of policy being driven by evidence, decisions are being made first, and supporting data sought afterwards. This approach, as Jernigan put it, represents a shift from evidence-based decision-making to decision-based evidence-making. Staffing cuts, funding freezes, and policy chaos. The administration's actions have included sweeping staffing cuts at the CDC through the newly created Department of Government Efficiency, DOGE, as well as funding freezes that appear haphazard rather than strategic. Former officials note that RFK Jr. did not hold any direct meetings with CDC staff or directors, instead relying on appointees who requested data from scientists without proper confidentiality agreements. This lack of engagement and oversight created confusion, especially when the administration promoted unproven treatments, like cod liver oil for measles, while simultaneously weakening public health infrastructure. For example, vaccine policy changes were announced via social media posts before being reflected on the CDC website. Escalating instability and violence, the chaos culminated in a violent attack on the CDC headquarters in Atlanta in August, where a gunman fired hundreds of rounds into the buildings, blaming the COVID-19 vaccine for his mental health issues. The secretary's response, telling the public, "Don't trust the experts," during a media interview shortly after the shooting further eroded public trust in the agency. The future of public health. The 3 former directors now advise the public to seek health information from vetted sources outside the CDC, including academic centers like the University of Minnesota's CIDRAP, regional health alliances, and professional medical organizations. Oury bluntly stated, "I don't know if CDC will survive, to be quite frank, with what they're doing." The agency's long-term viability hinges on whether the current administration will reverse course and prioritize science-driven policymaking. The events unfolding at the CDC raise serious questions about the future of public health in the United States and the ability of the government to respond effectively to future crises.